We start with the daily COVID-19 situation in South Korea. COVID-19 cases have bounced back to more than 2,000 again today. Health authorities are on their toes as a three-day holiday is around the corner this weekend, and that means the total caseload is expected to rise in the coming days. For more on this, we have our Won-jong in the studio with us. Won-jong, welcome.
Good afternoon.
Now, South Korea's health authorities have announced the daily COVID-19 infection situation today, this morning. Can you tell us more on that front?
Right, so new COVID-19 cases in Korea have climbed back to over 2,000 again. And there were 2,028 cases reported on Wednesday. Of the total cases, all but 26 were locally transmitted, and the total caseload is now over 323,000. Let's look at local infections from today. The 1,495 cases were from the Greater Seoul area, and that's more than 74% of all infections. And still, Seoul holds the most cases overall. And so far, 39 million people have been vaccinated with at least one dose, now over 77% of the total population. And nearly 28 million people have been fully vaccinated, and that's more than 54%.
Now, Won-jong, let's talk about the vaccination program. Authorities have announced the vaccination plans for pregnant women last week. Can you tell us more on that?
That's right. So pregnant women are next in line starting this Friday. And according to the KDCA, the pregnant women who like to get the COVID-19 vaccine can apply online from 8 p.m. Korea time. They will be getting mRNA vaccines such as Moderna or Pfizer.
But I heard that concerns among pregnant women still linger. I heard, and you also met some of them?
Right, so I met several the pregnant women in South Korea, and obviously this is a very sensitive topic to discuss about. It's because it's something. It's not just related to only the mothers, but it's also the children as well. And last week, our news team met Cho Jin, who's 22 weeks pregnant and still goes to work every day. And she told us that she's worried about catching COVID-19, but hasn't had her first shot of the vaccine yet. Let's take a listen.
I don't think I'm going to get vaccinated because, first, this was an emergency approval with not enough data. I'm sure there's an impact after catching COVID-19, but we just don't know how the vaccine will impact my baby and myself.
So she said she already had her flu shot and felt that it's much safer than COVID-19 vaccines, and because it's already been widely used for a long time.
Now, Won-jong, staying with the topic, what can you tell us about the possible risks of these COVID-19 vaccines on pregnant women? Right,
so this is something I found very, very interesting. It's because the research shows that the pregnant women are at more risk than others from COVID-19. Now, the Journal of American Medical Association in August said that the unvaccinated pregnant women with COVID-19 are 15 times more likely to die and 22 times more likely to have a premature birth. And here's what the expert said.
The American College of Obstetrics and Gynecology issued a strong medical consensus statement urging all pregnant individuals to get vaccinated against COVID-19. And the rationale is because pregnant women have a high chance of developing severe COVID-19 and also from dying due to COVID-19.
Right, so another expert told me that the misinformation and lack of understanding about the vaccine still remains, and that's why many pregnant women feel reluctant to get the shot. And that's something that really need right now at this moment, because the more sufficient information is supposed to be being available for them and as well as doctors.
Thank you so much, Won-jong. I assume you prepared a lot for this today?
Well, trying to, right?
We'll see you again tomorrow.
Tomorrow.
Thank you.